Hey, everybody. Welcome back to the Healthy, Wealthy, and Smart podcast. I am your host, Dr. Karen Litzy, owner of Karen Litzy Physical Therapy, located in the heart of New York City. And on today's episode, we are going to talk about how to demystify healthcare. So you could be a savvy patient, or if you're a caregiver, a savvy caregiver and support for the patients in your life. So I'm really happy to introduce Dr. Jacob Kendall. He is a survivor of 2 open heart surgeries, a public health gerontologist, a 4-dimensional polythinker, and don't worry, we'll get to that, and a lover of quantum mechanics and Stephen King. Jacob, welcome to the podcast. I'm really happy to have you on.
Yeah, thanks, Karen. I appreciate the opportunity to have a good conversation here. Thanks for the introduction. And I know we're going to have some good things to talk about.
Absolutely. But before we get to that, can you tell the listeners a little bit more about yourself? Because I'm sure as people heard 2 open heart surgeries, that seems like a lot, but tell everyone a little bit more about yourself and kind of your trajectory through the healthcare system and as a patient and also as someone who's kind of studying this.
Yeah, for sure. So I'll focus on 2 aspects that inform my personal life. Now, I'm a father, a spouse, and family is important to me, and I have all these interests. But the 2 things I'm going to focus on, and if any of that other stuff comes up, that's fine. But as far as the topics that you've mentioned, and the reason I reached out and what informs my professional pursuits, I would say it breaks down to 2 things. These are the 2 most important things to me. One, and this will get more to the 4-dimensional thing, but I consider myself a true interdisciplinarian. Um, I've yet to find a good term that works outside of academia. I was raised into academia. I was a professor for several years. I have the PhD, so that's the way that I think. So hopefully that term will work for now if anyone has any ideas on better ones. But basically, I really, really enjoy thinking about a topic from multiple perspectives. My PhD is in interdisciplinary aging studies. Now that's a lot of syllables, so I just usually say gerontology. But
Mm-hmm.
that's what it is anyway. But we learned, and I've learned how to facilitate dialogue about aging, about health, about chronic disease from uh, across boundaries between disciplines that don't typically interact with one another. I'm not talking about cellular, molecular biologists and geneticists. I'm talking about all the way through the social sciences, epidemiology, demography. I really think they're just, yeah, I but much prefer to be a jack of all trades and an expert of none. And that's how I like approaching things. I think that we need some deep experts and we need some true interdisciplinarians in the world.
Mm-hmm.
So that's where I come from when I look at any issue. And then the other thing is, like you said, I've had 2 open heart surgeries. I have complex medical care. Have lifelong experience of navigating our overly complicated, unnecessarily complicated healthcare system.
Mm-hmm.
And over the years, I have combined that with my formal training in social work and public health, biology, and I've kind of developed some strategies and different ways of thinking about health that have helped me. And I've also helped, like, sometimes I'll go to appointments with my mom, who also has complex medical care needs. And so, anyway, from all of that, I also can identify as a chronic disease advocate. I
Mm-hmm.
think that we're a vulnerable population, especially in this country, with healthcare being the way that it is. So, those are the 2 main things that come together for me.
And I love that you kind of learn these lessons and then you're able to pass them on. So talk about some of the lessons you learned as you've gone through the Medicare or through the medical system and also studied it.
Yeah, as an intro to the 4-dimensional thinking piece, the way I usually word this with healthcare specifically is that health is more than individualistic, medical, here and now. Those are the 4 dimensions. So it's more than individualistic. Let's just focus on that one. We live in a society in which American individualism runs amok. I would say that we've gone too far down that end. When people tell me things like, well, I would not want any kind of national or socialist healthcare system because then I wouldn't have the freedom, the autonomy to choose my own provider. And whenever someone says that, I think 2 things. First of all, you don't have complex chronic disease in saying that. And secondly, this the notion of having autonomy in our healthcare is more of an illusion than it is a reality. And we really can't realize that until we zoom out to other levels above that, right? And I can give a specific example here in a few
Great.
moments, but the another dimension is the medical. I think I think it's getting better, but definitely, people in my parents' generation, there's this notion that doctors, you should listen to what they say. Physicians, you should listen to what they say, and they, that they know your condition best, and they're definitely great, but they don't know everything. And you can hear one thing from one and another thing from another. And I think that we have to be having these other disciplinary or other industry perspectives on health. And I know you as a physical therapist will probably agree with that. I
Mm-hmm.
have chronic back pain. I've seen multiple physical therapists, and I always learn things from physical therapists that I don't learn from more mainstream medical doctors. I'm in a
Mm-hmm.
Facebook group for other people who've had heart surgeries like mine, and some of the things that I've learned there, and I'm like, this is why do my cardiologists not tell me this? So
Mm-hmm.
medicine is more than individualistic, and it's more than medical. I can get to the other two dimensions later, but taking all of that, I've been able to connect those dots to my own personal experiences, and it's just been really enlightening. It explains a lot, right? Uh, do you have another question, or I can give an example of?
Yeah. Why don't you? Well, first of all, I don't have another question, but I will agree with you. And I'd just like to make a comment on one thing when you said, people said, oh, I want to be able to go to the practitioner of my choice. I want to go to whoever I want. It's like, newsflash, you can't do that now because a lot of practitioners don't take certain insurances. If you're in an HMO, you may not even know you're in an HMO, but you can only kind of see the practitioners with that your insurance allows you to see unless you want to pay out of pocket. So it's like we don't have that now. So I'm glad you brought that up, and I just want to make a comment on that. And now I'll hand it over to you for an example.
Yeah, and honestly, that's just one variable, and
Mm-hmm.
that's all we need to show that we don't have that autonomy. But I'll give another one, because inevitably people always ask me, "Well, I'm just a patient or I'm just a caregiver. Like, how does zooming out to higher levels mean anything for me?" Well, let me give you an example. So I live in one of the fastest growing counties in the U.S. It's Baldwin County. It's across the bay from Mobile, Alabama. And I know
Okay.
that would probably surprise a lot of people. It is a really fast growing area.
Oh, actually, I
Um,
do know that because I saw a TV show
uh,
about it. Um,
oh,
it was really interesting. And it
huh.
looked like a beautiful, they were in this little town. It was a YouTube thing, Peter Centinello. And he was in this little town across the bay from Mobile that was very artsy and it just looked like really adorable. And they said that it is like that whole area is actually growing so quickly. And I have to say, I was really, really surprised.
Was it Fairhope?
Yep.
That's the town I live in.
That's the town. Yeah, that's it.
I
Yeah.
don't know if it's the show. My wife also watched some reality TV show about Fairhope, and it presents it in a as if it's a much smaller town than it actually is.
Uh-huh.
But it is a nice area. So
Yeah.
anyway, you go out driving within 5 minutes, you're going to be able to observe that this is a fast growing area because you can't go that long without seeing some apartment complex go up or some clearing the land for a new subdivision. And then a month later,
Mm-hmm.
it's a whole bunch of houses there. Like it's clear that it's growing. So when I first came here, I always, because of my medical needs, I always have to immediately establish myself with my providers
Mm-hmm.
more quick sooner than my wife does. As an example, I went ahead and got in with my general practitioner, and then a few months later, when my wife tried to find her GP, my office was already filled up. And because I'll get to that in a moment. But I started to notice in my first several months, like, wow, this is long wait times. Like, wow, I got to schedule these appointments way out in advance, or
Mm-hmm.
some of these providers are no longer accepting
New
new patients and
patients.
whatnot. And it can be really easy. It can be so easy. And I used to be this way, to get frustrated with the providers themselves or the offices themselves. And for many years, I'm like, man, these physicians have just got to do a better job. But more recently, I'll just straight up ask them, like, they're just as much pawns in the entire medical industrial complex as we are. Um, and so I started thinking about it, and we had a water shortage last year, and then I
Mm.
started to connect the dots. And now every time I go to a new provider, I'm like, tell me honestly, are you concerned about the population growth in this area and how it's going to affect access to medical care? And many of them are like, yeah, I don't know how this city is going to handle it. We do not have the
Mm.
infrastructure.
Mm-hmm.
One of my providers, a different one was he said that he's been trying to hire a partner for a couple of years and the hospital won't let him do it. And it's like, you can't understand what the issue is unless you zoom out to the demographic level and look at the population growth in this
Mm-hmm.
area. Otherwise, you're just going to get frustrated with the doctor's offices themselves, and that's not the cause of the problem. So that's one
Right.
example where zooming out and understanding a little bit more of a macro issue is going to help you, get what's going on. Does that make
Mm-hmm.
sense?
Yeah. And I think it can also decrease your frustration and anxiety levels as well. If you kind of have a bigger picture, and like you said, if you can kind of zoom out from yourself and look at things like a little more rationally instead of emotionally, which is very hard because we are talking about your health. So I think it's inherently emotional because it is about you.
Yeah. And I also think that it helps you realize that the providers themselves are not really the cause of the problem. And
Mm-hmm.
I think at least for me, it's helped me be more confident about reaching out to them to be an advocate for me because they're not causing this problem. They're just as frustrated with insurance companies as I am.
True
And
story.
yeah, as long as they're curious and have good personality and bed manner, which is more of a personality issue than it is a
Right, right,
medical
right.
system issue, then they're probably more willing to be an advocate for me than I realize. I probably have to be a little bit assertive and have some self-advocacy, but
Mm-hmm.
they're not the cause of the problem.
Right, right. And so what advice, let's say, do you have for people who might be in a similar situation where they're calling, they can't get an appointment, they're not taking, they have to wait months and months? I hear that all the time, not so much here in New York because I mean, I'm in New York City. There's so many we've got a lot of medical facilities and medical care, but I'm originally from Pennsylvania. I hear from my friends who live there. They tried to get an appointment with their doctor and they said, "Oh yeah, sure. How about 4 months from now?" And they're like, "4 months from now? Like I'm having problems now." So, what advice do you have for people who might be in similar situations?
Yeah, and I don't know what it was, if any of the following is going to be new or whatnot. Kind of took me some years to learn it, but I mean, there
Mm-hmm.
are various things. If you're already established with a provider, one thing that I do is I make sure that I know all the ways that I can reach their office. So I have a couple providers where I have their nurses or even my provider's work cell phone number.
Mm-hmm.
And I try not to over text them, but if I really need something, I'll text and it's their work
Sure.
number. So they'll respond during hours, but sometimes you don't get those unless you ask, right?
Mm-hmm.
I always ask, do you have a patient portal where I can send messages that way and things like that? I think I mentioned earlier, and I was in a conversation with someone that I am in a Facebook group with people who have had I think I did mention that
Mm-hmm.
who have had my similar kinds of surgery, and we're on blood thinners. And so I go there and look for good questions. And sometimes I can
Mm-hmm.
find the answers there more quickly, and sometimes there are even better answers than I can from my physician. I always make sure whenever I think of a question that I'm going to want to ask my provider, the next time I have an appointment, I have a note in my phone and it's
Mm-hmm.
separated by the different types of providers. And I just make a bullet point list and put the question in there when I think of it so that I don't forget it. And I go through
Right.
that checklist when I'm sitting with them.
Right. So it sounds to me, what I'm hearing is it's all about communication. So know how to get to those lines of communication open to you and what works best for you, whether it be a patient portal, a phone number, a text, or an email, and knowing how to communicate with that doctor when you get them on the phone or when you're in the office. And I do the same thing. I tell my patients all the time, the moment you think of something, you write it down. Or what I'll do before their doctor's visit, I'll sit with them and we'll go through every question that they might possibly have. And I write it all down for them because sometimes like doing it on the phone is, so we'll write everything down on a piece of paper. We'll take a picture of it with their phone. We'll make sure that they have it with them because, oftentimes people are going to these appointments by themselves. And I don't know about you, but I work in healthcare. And when I go to the doctor, I'm like, oh man, I meant to ask that question. I totally forgot. So I do the same thing. And I think that's great advice.
Yeah. And I have to acknowledge something here. I want to be fair to acknowledge something. I'm a white male, and it is easier for me to be confident and assertive than it is for other people to do so. And I understand that we have that social situation. And I can't deny that the fact that I'm naturally kind of devil may care sometimes, and wanting to get what I want, is definitely a contributing factor in me getting some of these answers. So because I talked to several people about this, and they'll say, like, you said that to your physician, like you asked them that, or you said that. I'm like, yeah, I did. And they responded to me. Like, I think there's a lot of people have the idea that I don't know, there's some kind of decorum that you should have with your provider. And of course, there's some who want to maintain that professional distance, but I think that there are more out there who are fine with kind of, wrestling in the mud a little bit with you. So I'm not going to sit here and say this is all easy and you can do it at the snap of a finger. Sometimes you gotta build the skills of assertiveness and self-advocacy. And I just have to be honest about that fact, because you do, you don't want to get to the point where you annoy them so much they don't take your calls anymore. But sometimes you got to push a little bit, right? So I just want to acknowledge that that's the case. This is not a switch that I can just say, okay, go flip this switch and it's going to change for you.
Right. Yeah. And I'm glad that you brought that up, because I think that's very true. We know in the history of medicine and medical care that there are certain people who are not taken as seriously. Certain groups of people, women, people, who are, if you want, Black and brown people. A really great book to kind of dive into if you're interested more in that topic is It's Legacy by Dr. Uche Blackstock. It's a fabulous book, and she talks about the disparities in healthcare, one of which is exactly what you just said. So thank you for bringing that up, because I think that it makes a difference. I mean, we know that there's a difference in the way men and women are treated. Women were always thought of to be hysterical, so they would never get pain medication, whereas men would be like, oh, you must be in pain. People of color, same thing. Doctors thought they could tolerate more pain because they're a person of color, so they wouldn't get that pain medication. So,
and older adults, like, well, you're just old. Like, yeah, I mean, it's
exactly. There's so many different populations where it's a little different. And sometimes you have to, like you said, advocate for yourself, have someone there to advocate for you, and try and really create that, as best you can, relationship with your healthcare provider. Having that patient relationship is so important.
What is before I respond to that, what is the name? What is the author of that book?
Yeah, it's Uche Blackstock, Dr. Uche Blackstock, UCHE with the little thing over the E. I forget what it's called.
Got it. I'm adding it to my
it's a fabulous book. I listened to it. And she's a really interesting physician. Her mother was a physician, went to Harvard. She and her sister, twin sister, I believe, both went to Harvard, both became doctors. So that's the legacy part of it. But it's really fascinating, and I think it would really coincide well with your talks and with your experiences.
Yeah, awesome. I just put it on my want to read list. That definitely sounds like one I need to check out.
Yeah, it's great.
And you don't even have to have 100% of your providers be great, even if you have just a few who are in your corner. Because I recently had a situation where there's one office, it takes so many months to get in with him, but my maybe he's a neurologist, but I had a situation come up, and so my cardiologist knows this guy. My cardiologist is one who goes to bat for me, and he got me in to see that neurologist a lot sooner. And so, you have one or two providers who can be an advocate for you, and sometimes that can. And my GP is the same way. If she needs to give one of my other specialists a call, on my behalf, then that can happen. And my brother also said something very interesting recently too, that he prefers to have medical providers. He was recently diagnosed with Crohn's disease. We got all kinds of chronic issues. He said he'd prefer to have providers who are curious, and I agree. I like ones who are willing to look a little bit extra up and dig a little bit deeper, and not just accept things at face value. Again, they're not all like that. You're not going to make them that way, but if you can have at least one or two like that, that can get you pretty far.
Yeah, I couldn't agree more. Now, going back to that 4-dimensional thinking. So we started out with individualism and the medical aspect of it, what are the other two aspects of that four-dimensional polythinking?
Yeah, it comes from space-time. So you have 3 dimensions of space and 1 dimension of time.
Okay.
And so the zooming in and out is up and down, and then the different disciplinary perspectives, the medical versus other perspectives. So I basically gave you a medical versus demographic perspective just to make one, comparison.
Mm-hmm.
That's 1 dimension. And then another one is the here means geographically. You know, I guess it's interesting to compare different places. And so my wife and I have talked about moving from here, and there are various reasons for that. And my concerns about healthcare access moving forward are one of those. And so we started looking into other cities, and there are various amenities that the airport we have here is too small. We don't have good access to the interstate.
Mm-hmm.
And it's hard to find a large enough city that has those things, but one that's not blowing up too much to where you're still going to have good access. And so it's just really interesting to think about, different geographic areas. I'm just giving you one example of how to consider that. And then there's the time piece as well, how it changes over time. So yet again, I'll give you another example.
Great.
I got a life insurance policy not long after we got married a few years ago, and we both got one. And hers is way better than mine. Quite frankly, I'm surprised I got one because I'd had 2 heart surgeries, and I knew it was going to be hard. And they approved me at the time for 22 years. I think it's at 20 years now. And I called the guy up, and I wanted to know, because I was trained by a demographer. I basically know how life table analysis works. It's all demographic analysis. And he's like, yeah, based on your medical history, we can't insure you beyond 22 years. And I half jokingly, but I think he thought I was completely serious. So you're saying you think I'm going to die in 22 years? And he just kept on going back to the same answer, like, well, we just can't insure you beyond that point. And I'm thinking to myself, I really hope that he answers the phone in 20 years when I want to re-up my life insurance. But it goes into life insurance is based off so many different things. It's a population level measure. You have all the people who have all your same things.
Mm-hmm.
What is their typical lifespan? But they don't account for everything. And so it's just important to, I guess, keep in mind. Again, life tables are based off predicting the future. And as a gerontologist, to just give one more example, one of the most common questions that people have asked me when they find out that I study aging and that I'm a gerontologist is like, oh, so you're trying to figure out how to get us to live longer. And I'm like, wait, quality is important too.
Mm-hmm.
Can't tell you the number of times that we're just obsessed with living longer, but we're not obsessed with living good years longer, because we actually have a
Right.
lot of years of disability and morbidity here in our society. And I actually think that focusing on quality helps add to the quantity. So I
Mm-hmm.
just think that we need a different way of conceptualizing the time dimension of our health. Does that make sense?
Yeah. And what is that way? Have you figured that out? Like, from a time perspective, how should we be looking at our health?
Yeah, and I could always mention, I could get super nerdy and mention things like ACEs. There's a lot of
Please.
studies showing that adverse childhood experiences, or even things that happen to you while you're in the womb, increase your likelihood of developing chronic disease 30, 40, 50 years later. We could get
Mm-hmm.
nerdy and talk about
Mm-hmm.
things like that. And yes, that's true. And that's part of the reason that I personally take a lifespan perspective of aging, as in aging begins the moment you're born.
Mm-hmm.
Um,
Well, it's true.
yeah, I mean, I think that's very useful to think about that. And another way of looking at it is we have to be having conversations about changing the structure of pensions and Social Security and our thoughts around retirement, because we're getting to the point where people are living an entire third of their lives after the typical time to leave
Mm-hmm.
work. Um, and uh, again, I think it's getting better, but I mean, we're seeing it right now with the baby boomers. they haven't all planned well for this. They haven't.
Right.
And they'll tell you
Right.
that. They'll tell you, and people in their 70s, 80s, and 90s, I'm like, I didn't expect to live this long. I had no idea I'd have to be preparing for this.
Mm-hmm.
And I think that that's part of it as well. Another, I mean, I could name several things here. Another thing that comes to mind, and a lot of this is not long after my wife and I got married. A month later, my dad had a debilitating stroke and heart attack, and
Mm.
we had already planned to move to North Carolina, but my parents were still in Birmingham. I could not leave my mom to care for him on her own, so we scrapped our plans, moved to North Carolina. We already had a house and everything, but we were like,
Mm.
I can't leave that. So we moved there to help with that, and then he died 6 months later. We had already all moved back down here, so we moved twice. He died. I started another business. I started another graduate program, and then we had a child a year later. And like we started joking about, well, we should help people who are earlier in their years of marriage who go through all these things. And after a while, I'm like, I don't know if that should be a joke. But Americans are just so bad about not addressing issues until the issues arise.
Mm-hmm.
Is there a way? Is there a way that we can think futuristically about, I mean, we're going to be hit by these things. There's no one that can go their entire life without being majorly impacted by chronic disease, whether it's theirs or loved ones.
Mm-hmm.
And I don't know how to convince people to think in these terms, but we need to be thinking ahead of time, right? And I know I'm
Yeah.
preaching right now without giving a solution. I'm recognizing a problem without giving a solution. I acknowledge that, but I know that it is a problem. Does that make sense?
Yeah, I think so. And a little bit that goes back to um something that I often hear is that most Americans, if they are hit with a surprise, what is it, 500, $800 bill in 1 month, that could kind of wipe them out, So imagine what a chronic health condition can cost you,
Yeah,
right?
tens of thousands of dollars easily, easily.
Mm-hmm. I mean, I just like, I'm, knock on wood, pretty healthy, but like my cat was just sick and needed surgery. That was $11,000 for a cat. I mean, I have pet insurance, and I will
Wow.
tell you, pet insurance is pretty good. If only people insurance worked as good as pet insurance did, we would be in fine shape. He can go anywhere he wants. He has a $250 deductible, and we got reimbursed at 90%.
We have these examples of how it could work, but we're
Done.
not using them.
Done and done. Super easy. I mean,
Yeah.
I had to put in a lot of paperwork, but once all the paperwork got in, they put it in, they reviewed it, I got paid in 2 days. Direct deposit right into my account. Could not be easier. Right. But, you know, again, it goes back to this. Like you said, it's easy. And that's how our human healthcare system should be. But it's just so much more complicated unnecessarily. So we're lucky that there's people like you around who's you're giving lectures, you're going on podcasts, you're trying to teach people kind of how to navigate this system with a little bit of ease and a little bit of self-respect and grace, because it could be really demoralizing.
Yeah, it can be. And it's also demoralizing. Here I am trying to convince people to advise people to remember that not everything happens at the individual level. Let's zoom out some. But at the same, everything's a balance, right? So at the same time, I also have to, I'm acknowledging here and now, if you zoom out far enough, you're going to hit a ceiling
Mm-hmm.
because the medical industrial complex and health insurance companies, they don't give a damn about us,
Mm-hmm.
right? Like if I were to talk about solving these problems, or you or anyone else, with health insurance companies or the other ones who are in power, they wouldn't care. I mean,
Well,
they're sleeping on beds of cash, right?
yeah, well, the goal of an insurance company is not to pay.
Yeah.
You
Yeah.
pay them every month, but their goal is to never have to pay for any of your care.
Right. So, I mean, I want to acknowledge that if you think about this in certain ways, healthcare is a intractable problem, and I just want to be fair to say that, but I still think that there are ways that we can squeeze more juice as individuals, as caregivers, as families,
Mm-hmm.
as local communities and whatnot. There are things that we can do to get more out of our experiences, and if that's all that anyone gets out of it, me talking about this, that's better than nothing, I guess. But
Mm-hmm.
I just want to acknowledge that at the top levels, yeah, it's probably an intractable problem.
Yeah. Yeah. And so did we miss anything from that sort of convergent four-dimensional approach?
I hope that I offer good enough examples to more or less show what I'm talking
Mm-hmm.
about. I mean, it takes a lot more than an hour, but I at least want to introduce that that's how I tend to think about things.
Yeah.
Being an interdisciplinary person.
Yeah. And, you know, as a healthcare provider, an interdisciplinary team is the best with the patient in the center. So you have that patient-centered care with the team orbiting around you and involving you and educating you so that you can make an informed consent on all of your healthcare needs is the ideal, right? In an ideal world, that's kind of what we want. And I think that's what I try and create for my patients. I'm sure with your cardiac history, you had that, I hope, that multidisciplinary team caring for you at those times.
I've been very fortunate to have I had two different surgeons, and both of them are very good
Mm-hmm.
at what they do, and I'm still in contact with my first one and my cardiologist here. Most of my providers here where I am are really, really good.
Yeah.
And some of that is geography. If I were to go 30 miles north, it wouldn't be the same when I have, I have to recognize that. But I definitely have been fortunate to have some good providers. And I do agree with you that, you need different people sitting around the table.
Mm-hmm.
That's not even perfect. I'm a social worker, and I also advocate for a lot of social workers who get shitty pay. And I can't tell you the number of times in the hospital settings where social workers are like, I'm contributing just as much to this team. I work just as hard. I provide just as much expertise, but of course their pay is nowhere even remotely close to the nurses and physicians. So
Right.
that doesn't fully solve the problem, but I think it's going in the right direction if we can use that model.
Yeah. And I think it's also from as we start to kind of wrap things up, some of the things that I was struck by from our conversation is that location matters. And we know your zip code is oftentimes the one of the top contributors to your health overall is your zip code. It's where you live. Um, and that it's okay to advocate for yourself, and it's okay to ask questions, and it's okay to also seek out a population outside of your doctors. Like you said, you're in some different groups and things like that of people who have had similar experiences, and I'm okay with that. I think that's fine. Support groups, that's what they're there for. They've been around for centuries, right? And I think they're a really important part of your healthcare ecosystem.
Yeah, and I often start there because then it decreases the number of questions that I need to ask my provider because inevitably they're going to be in a hurry and you can't ask them 25 questions.
Right.
But if I can knock some of those questions off before I even go see them,
Mm-hmm.
that really helps.
Yeah, and you may also be able to find a provider through those people as well, through those groups. So don't discount the support groups or those common people with common experiences, because they can really be part of your advocate team.
Yeah. And there are days, listen, it was a devastating moment when I learned that I had to have my second heart surgery.
Mm-hmm.
I wasn't even 35 yet, and I've already had my second one. You can only have your valve replaced so many times, and it's not much
Yeah.
more than two. And so
Yeah.
it was a devastating day. But I'm in this group, and there are people who've been there, done that, and some of them have been around for a few decades. And so yeah, a lot of negative people also go on there, but you have to realize, what, there's people with good stories out there. So it
Yeah.
can be
You can
good for your
filter.
emotional health.
Yeah. Yeah, absolutely. So, what would you like the listeners to take away from the conversation today?
I think we live in a time, and I'm sure that no one's going to disagree with this, in which using good critical thinking is a necessity in our society today. We're very polarized culturally, ideologically, and so most people are going to agree, no matter what side of the proverbial aisle that they're on, that we need better critical thinking here
Hmm.
in the U.S. And what I want people to know is that don't just use those skills to talk about cultural, ideological, or social issues. Take that and be a critical thinker about your medicine as well. And the buck stops usually at a farther point down the path than you think that it does. Don't, your physician is not an end all be all. Seek out these other pieces of sources of knowledge and practice your assertiveness. If you're someone who is just really uncomfortable being assertive, uh, then why don't you each time you go to the provider, try to ask one hard question that you're uncomfortable with, and the next time ask another tough question so that you build your skills of assertiveness
Hmm.
and self-advocacy. Once you start feeling it, it can be really, really empowering and it can grow on itself. So just apply the desire to be a good critical thinker to your medical and your healthcare experience as well. Right. That's
I
that's what I would say. Think outside the box, be assertive. It is okay to self-advocate. In fact, it's not okay to not self-advocate.
agreed. Agreed. Perfect. And where can people find you? They want to find out more about you. They want to follow you on social media. Where are you at?
Yeah, I'm on LinkedIn for the mostly that's where I do most of my stuff, Jacob Evans Kendall. And I have a website, jacobevanskendall.com. That's mostly for doing speaking engagements on these
Mm-hmm.
topics.
Mm-hmm.
And LinkedIn is for also that, but also one-to-one interactions and whatnot. So I would say those two things.
Okay, perfect. And so no matter what platform you're listening to right now, if you go to the show notes under this episode, you can, one click will take you to both LinkedIn and to Jacob's website. So before we wrap up, one last question that I ask everyone, knowing where you are now in your life and career, what advice would you give to your 20-year-old self?
Other than not to take out so many damn educational loans.
Well, yeah.
Um, so much of what I would tell my own younger self is probably just pursue different educational paths. I went into the social sciences because I thought that things that were more explicitly focused on humans would have a more impact. But my true love is biology, and I really wish I'd gone into that. So I guess I would say, do what you want, and you're probably going to be a lot happier doing that. I've gone through the back door through so many parts of my professional career, and I've had an adventure doing so. So I don't really regret anything, but there are definitely
Hmm.
times I'm like, man, I could have made this a bit more efficient if I
Could,
just listened to my gut instinct in the first place.
yeah, yeah. Great advice. Listen to your gut. It rarely steers you in the wrong direction. So Jacob, thank you so much for coming on the podcast. Great discussion. I really appreciate it.
Likewise, I enjoyed the conversation, Karen.
Thank you so much. And everyone, thanks for tuning in and listening. Have a great couple of days and stay healthy, wealthy, and smart.